So let's believe and pray. Mighty Fortress, we are now getting into the study. May you be with us and keep our thoughts stayed throughout this session is my prayer, trusting and believing in Jesus' name. Amen. So yes, yesterday our main objectives were we wanted to study certain upper respiratory infections, and we saw some causative agents to the upper respiratory infections, and we saw three. We saw two, though in my slides I listed three. We saw bacterial infections, we saw bacterial and viral infections, and we saw how the Saviors placed certain defense mechanisms in our body to actually help ward against disorders, to help protect us against being diseased. And number four, this we didn't touch like clearly. We didn't touch on it deeply, but we will see the lifestyle and the respiratory system. And then yesterday we saw some treatments and preventions and management, though I didn't include them in my slide, but today they're in the slides. And so that's the basic objective that those are the objectives, those are the studies, those are the things that we studied in our last class. And so today our main objective is studying asthma and just knowing the pathophysiology of asthma. I believe we all do understand what pathophysiology is, this being our 22nd class. And so the respiratory infections, we have two tracks. We know I've talked about the organisms. The third one is fungal infection. I'll just pass. So we talked about these five defense mechanisms that I elaborately explained yesterday. And then we saw some of the factors that can weaken the respiratory barriers, or rather the respiratory defense barriers. We saw cigarette smoking, we saw respiratory pathogens, of which the respiratory pathogens are the viral infections, the bacterial infections, and the fungal infection that is normally likened to a specific type of asthma. And then we have some strain and tension that we'll get them from the spirit of prophecy. And then we have insufficient air, outdoor exercise, rest, and sleep. They could also weaken the defense barriers that we talked about yesterday. So, some of the upper respiratory infections that we mentioned was one of them was the cold. We mentioned two. One of them was the cold. We saw certain viral pathogens that can invade, or rather that can result to a common cold. And those are the three pathogens that we saw, and mostly the viruses. And we said that they can enter our body through the mucous membrane of the nose and the eye. And that's why during the COVID-19 pandemic, we used to be advised to wash our hands regularly, so that in any case, if we touch our mouth, if we touch our eyes or even our nose, we can't get infected by these viruses. And spread readily through respiratory secretions that we mentioned can be passed through cough, sneezing, or hand-to-hand contact. And then manifestation of cold, we saw how cold can be manifested by inflammation of the nose, inflammation of the sinuses. The sinuses, we saw the four paranasal sinuses when talking about the anatomy, and we saw that sinuses are more of just holes in the upper respiratory system. And then pharyngitis, that is the sore throat or inflammation of the throat. That's how common cold can always affect us. And then today I added watery eyes and hacking cough. That would mean a dry cough. So we also saw influenza. I'm doing this first because we talked about these things yesterday. So I want to get to the treatments and elaborate on the treatments that I added. So we saw that influenza mostly it's called flu, and that's the virus that normally is related to it, and we said that this virus, it normally the virus that comes from these families, it normally affects birds and animals. And then we saw that influenza, influenza is normally it's normally we have type A, B, and C, and we saw the differences in type A, B, and C. And those are some of the common symptoms of influenza. I believe we read the slides I sent them. So this is a basic definition of what influenza is, and we read it yesterday. We saw the differences of cold and flu. And so this is where now I want to take much time. I included some quotations here from the Spirit of Prophecy to help us understand more how lifestyle is related to what we studied yesterday, colds and flus. So I placed here a few quotations from the Spirit of Prophecy. And so we'll read through. This is Selected Messages, Book 2, page 471, paragraph 1. The Spirit says, I appeal to you, mothers, do you not feel alarmed and heartsick in seeing your children pale and dwarfed, suffering from catarrh, influenza, crop, scrophal swelling appearing upon the face and neck, inflammation and congestion of lungs and brain? Have you studied from cause to effect? Have you provided them a simple, nutritious diet free from grease and spices? Have you not been dictated by fashion in clothing your children, leaving their arms and limbs insufficiently protected? So I want you guys to understand from this point, leaving their arms and limbs insufficiently protected has been the cause of a vast amount of disease and premature deaths. There is no reason why the feet and limbs of your girls should not be in every way as warmly clad as those of your boys. Boys accustomed to exercise outdoors, so number one, exercise, become inured to cold and exposure. So exercise really helps us ward colds and flus. Number one is the type of dressing. It should be warm. I believe I didn't list them in point form, but from just reading this passage, I believe we can see. So the very first thing she talks about here is exercise. And then the second thing she talks about here, I believe you guys can still hear me. There's a call I'm receiving. So. Okay, so we are there. There is no reason why the feet and limbs, that one we've read. So that one there simply talks about warm dressing. It helps us. Actually, colds are normally common during the cold season. Why? Because our extremities are normally exposed to cold, and that hinders the circulation of blood. And once circulation of blood is hindered, then the immunity.
Sauti yako imeenda chini kidogo, Denzel.
Oh, sorry for that. I believe I'm now clear. So I was saying that common colds are normally common during the rainy seasons, during the cold seasons, or rather the wet seasons. Why? Because our extremities are normally exposed to cold, and when our extremities are exposed to cold, then blood flow, or rather circulation, is lowered. And when circulation is lowered, then immunity in turn is also lowered. That's why we normally catch cold easily during the common cold seasons. And as you guys probably can remember, when we were defining the term disease before we started our first class in pathology, when talking about the digestive system disorders, we read from the spirit of prophecy what God says disease is. Disease is an effort of nature to expel impurities that have overburdened the system from improper living. From, let me just read it. I believe it's in page 127. Yeah, disease is an effort of nature to free the system from the conditions that result from a violation. That's Ministry of Healing, page 127. Disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. So that is disease, the body trying to free itself from impurities. So be it cold, be it a flu, it's the body simply trying to do away, or rather to eliminate impurities. These impurities might be pathogens that are coming from without. These impurities might be from within, just through our lifestyle, our diet and ways of eating. So we see exercise, we see clothing warmly. Daily, in this. I'll move to the next. Okay, before I move to the next slide, let me read the second last sentence. It says, delicate girls accustom themselves to live indoors and in heated atmosphere, yet they go from the heated room out of doors with their limbs and feet seldom better protected from the cold than while remaining in close warm room. The air soon chills their limbs and feet and prepares the way for disease. That one I've explained. And also there's some other thing that is introduced there about the atmosphere, the kind of air that we breathe. So in Testimonies to the Church, Volume 3, there's also a principle here given us. This is page 702, paragraph 3. The effects produced by living in close, ill-ventilated rooms are these. So this one here, the principle of the atmosphere, the kind of air that we breathe, is introduced, or rather our attention is called to it. The system becomes weak and unhealthy. The circulation is depressed. Why? Because maybe the air that we are breathing is poisoned by, let me say, emissions from cars, emissions from probably, let me say, burning stuff, and the rest. Simply just air pollution. So she says that the system becomes weak and unhealthy. The circulation is depressed. The blood moves sluggishly through the system because it is not purified and vitalized by pure, invigorating air of the heaven. The mind becomes depressed and gloomy, while the whole system is enervated, and fevers and other acute diseases are liable to be generated. So from the air that we breathe, we can be breathing ourselves into diseases or out of diseases. And so that's why the spirit of prophecy normally advises that when we go to bed, the window of our bedrooms should always be at least open for some proper ventilation throughout the night. And you should also not stay indoors in a room where there is no proper ventilation. And that's why we have the message of country living. The body becomes relaxed, the skin becomes sallow, digestion is retarded, the system is peculiarly sensitive to the influence of cold. I believe you guys can see the sentence I'm reading. Let me use my mouse here. From the body, from here, the body. I believe you can see my mouse. So the body becomes relaxed, the skin becomes sallow, digestion is retarded, and the system is peculiarly sensitive to the influence of cold. I really won't read everything. I just wanted to point us to these lifestyle practices that we normally do that can make us catch colds and influenzas. We can always take medicines, but if we don't take these things that we are talking about out of the picture when we are deceased by common cold or influenza, then it will really be hard for these remedies to always do away with them to help us, or rather, yeah, to help us recover. So I won't read all of it. And then lastly is from Testimony of the Church, Volume 3, page 13, paragraph 2. It says, the more perfect our health, the more perfect will be our labor. A very important point to note. When we overtax our strength and become actually, here, Ellen White's husband died because of overworking. So in this chapter, I believe it's chapter 18 of Testimonies, volume 3. But the chapter where verse page 13 is, she talks about the death of her husband, and she talks about overwork and yeah, of overtaxing our strengths and how is it normally called? Workaholic. There is it's that's the positive word that is normally used for it. Intemperance in line with your work and your duties. So we are told when we overtax our strength and become exhausted, we are liable to take cold. And at such times, there is danger of disease assuming a dangerous form. So we should always get enough rest. We should always ensure that we don't become workaholics to an extent that we overtax our strength, because this can also lead to colds. And if you have a cold and you continue doing these bad habits, then the remedies won't really help you that much, because the remedies will always try to help, but the lifestyle abuses will always try to pull them down. So I didn't talk about tonsillitis. Okay, I mentioned it. It's a very disgusting picture, probably to some, but we saw where the tonsils are located in our in the nasal cavity, and also in the mouth cavity. And tonsils are normally caused by either bacteria or viral. It's a bacterial or a viral infection. Tonsillitis simply means the inflammation of the tonsils. And we see this one, the picture on the left, we see some swelling. The tonsils are swollen. I believe we can see the tonsils. We did this in anatomy. These ones here, these two. This one, where there's some white, where there's these white appearances, these white spots, and these other end where the white spots. So we see them, they've swollen unnaturally, and that is one of the symptoms or the signs of tonsillitis, and they at times become red, and you'll sometimes see some appearances of white spots, and then recurrent headaches, sore throat, and those ones there are the symptoms. At times you might feel some fever and sore throat. So that's all about tonsillitis. So about the treatments, there's one thing that I included here, that is vitamin C. I realized I didn't talk about it. Vitamin C has always been used for treating colds, be it the flu or the common cold. So it has always been used in treating common colds. If you're using a supplement, 500 milligrams are normally 500 milligrams are normally advised to be taken three times in a day. They'll always help you prevent. And when you have the common cold or the flu, it will always help you. Recover. So these are some of the fruits where we can get vitamin C. That is the Kamu Kamu. I really doubt if it's in Kenya. The ones I believe and I know are in Kenya is bell peppers. Kamu Kamu mostly it's in South America. That's where it's found mostly. So bell peppers, I believe we know what they are. Bell peppers, hoho, hoho, yeah, something like that. And then we can increase our intakes of citrus fruits and pineapples because they'll always help us in case of colds and flus. So if you have a cold or a flu, you can always increase your intake of citrus fruits, pineapples, bell peppers, and we have baobab here with us in Kenya. Yeah. These are the ones I talked about. The most important one is eliminating of the causative factors, eliminating causative factors that we've talked about. So these are some of the herbal recommendations. I didn't include them in my slide yesterday, but these are some of them. So these these herbs that I've written here, they'll help in case of influenza, in case of flu, or common cold. The two, they'll always help. And I said when using a dry herb, you can always take 2 tablespoons in 250 ml of hot water, and then wait until it's warm, then take it. So there are two types of herbs. We have the hard herbs, and then we have the soft herbs. We have those that are sensitive, and those that are not sensitive. And the ones that are normally sensitive and soft are the leaves, petals, and the hard parts normally they are just the backs of the tree and then the roots. Those ones should be prepared by decoction. We had talked about decoction. The sensitive ones should be prepared by infusion. So taking 1 to 2 tablespoons of either of these herbs 3 times a day will help. So I included something here called a flu bomb, which I talked about. So I'll just pass. And then there's a natural cough syrup here that we can always make. I really don't know if I talked about it yesterday. I'm really not sure, but it will always help with if you have sore throats, if you have nasal blockages, nasal discharge, if you have a cough. So you can always use this natural cough syrup to help. And that's in ingredient one, the first cough syrup. We have onion and honey. So you can always take on a glass jar, put a layer of onion and add a layer, and to that layer of onion you can add 9 teaspoons of honey, and then you alternate the onion honey layer to the desired quantity. So the easiest way you can always make this, you can grate, or rather you can beat in a mortar and pestle one medium-sized onion. You can beat it, and then to that one medium-sized onion, you can pour 100 ml of honey, and then you stir it thoroughly, you stir it well, and then let it sit. After 1 hour, syrup will be formed. And the longest this syrup stays, the stronger it becomes. So you can start taking it after 1 hour. You can take 3 teaspoons 3 times a day, 3 teaspoons a day. 3 teaspoons a day, that is 1 teaspoon 3 times a day, 1 teaspoon 3 times a day. Or you can take 1 teaspoon after every 2 hours. That's for an adult. For a child, half a teaspoon, a child that is weaned. And then the second ingredient, we have honey and eucalyptus. This is what the Spirit of Prophecy talks about. And we'll read some quotations that honey and eucalyptus oil cough syrup is mentioned. So to this, if you are making it for a large family, you can always use 1 cup pure honey and 8 drops of internal use eucalyptus oil. You mix it well, and then 1 teaspoon, 1 tablespoon for adults, 1 teaspoon for children. And you can take this 3 times a day, and 3 times a day. You can always take 1 tablespoon when you are retiring to bed. It will always help. For small quantities, maybe if you're making it for yourself, for a time you can always take 2 tablespoons to 1 drop of eucalyptus oil. 2 tablespoons to 1 drop of eucalyptus oil. And the dosage is as mentioned above in red: 1 tablespoon to adults, 1 teaspoon to children. So that's the natural cough syrup. And this is why we find it in the Spirit of Prophecy. This is Selected Messages, Book 2. This is Selected Messages, Book 2, paragraph 2. Selected Messages, Book 2, page 300, paragraph 2 says, I am very sorry to learn. Give me a minute. Someone can kindly read it to us. Selected Messages, Book 2. Someone can kindly help us read it.
I'm very sorry to learn that Sister C is not well. I can advise any remedy for her cough better than eucalyptus and honey. Into a tumbler of honey, put a few drops of the eucalyptus, stir it up well, and take whenever the cough comes on. I have had considerable trouble with my throat, but whenever I use this, I overcome the difficulty very quickly. I have to use it only a few times, and the cough is removed. If you use this prescription, you may be your own physician. If the first trial does not affect a cure, try it again. The best time to take it is before retiring. Letter 34. Sorry, I'm not going to read those ones. I have already told you the remedy I used when suffering from the difficulties with my throat. I take a glass of boiled honey, and into this I put a few drops of eucalyptus oil, stirring it well. When the cough comes on, I take a teaspoon full of the mixture, and relief comes almost immediately. I have always used this with the best of result. I ask you to use the same remedy when you are troubled with the cough. This prescription may seem so simple that you feel no confidence in it, but I have tried it for a number of years and can highly recommend it. Again, take warm foot bath into which have been put the leaves from the eucalyptus tree. This is great virtue in those leaves. And if you'll try this, you'll prove my words to be true. The oil to eucalyptus is especially beneficial in cases of cough and pain in the chest and lungs. I want you to make a trial of this remedy, which is so simple and which costs you nothing.
Okay, thank you. I was looking at the chats and I've just seen some message that was sent 18 minutes ago saying my voice is not that audible. So I'd love to ask, is it now audible? I believe it has been audible.
It is.
Thank you. So You can always use that remedy in case of coughs. Honey is antibacterial. It will help fight any bacteria in your body that it comes about. And so that now leads me to the second thing that I didn't mention, that is steam inhalation. If you have nasal passages or nasal discharge or runny nose, you can always use steam inhalation. If your chest is congested, you can always use steam inhalation. And in using steam inhalation, those are the three things that you can always use. We'll be talking about these procedures of ailments. We have a unit on herbology, and we'll talk about, I believe we'll show practically how steam inhalation should be done, and can be done practically from the first step, and a few hydrotherapies that we'll study. So these are the three things that you can always use for steam inhalation to decongest your chest and to facilitate drainage, the nasal passage. Eucalyptus pepper and camphor oil. You put drops of eucalyptus oil, peppermint oil, or camphor in hot steaming water. Then you cover your head with some cotton cloth, some cotton towel, as seen in that picture. Just cover your head, and then you breathe that steam in. You breathe the steam in. So you should cover your head like completely. Your head shouldn't be seen by someone watching you. So you should cover your head and the pot or the basin that you're using like completely for it to be effective. This can be used for any flu. For if your nasal, if your sinuses are blocked, if you have some nasal inflammations and congestions of the chest, it will help. So steam inhalation. You can also always help. You can also use it for those who have asthma during the allergic periods. During the allergic periods, during the time that they are facing the attacks more. And then finally, the green pharmacy, before we get into asthma, the green pharmacy. So pharmacies where drugs are stored, pharmacies where you get your drugs, blah, blah, blah. So a green pharmacy would simply mean some natural remedies that you can always use. I believe we know how to prepare natural remedies now by infusion or decoction, and also the dosage of herbal remedies. Herbs should always be used. There are those that should always be used for at least 2 weeks, at most 2 weeks, and you can use them for more than 2 weeks under certain circumstances. So those are some of the herbs that I listed. If you have laryngitis, you can use those herbs. You just prepare them in the way that we've talked about. If you have asthma or bronchitis or hay fever is an allergic. It's an allergic fever. It's normally a seasonal fever. And then laryngitis, you can always use stinging nettle. Stinging nettle is very powerful. It's a very powerful blood tonic, so it's very helpful when it comes to treating allergies. So we have plantain. Plantain can be used in treating sore throat, laryngitis, cough, and bronchitis. Plantain, I really don't know if we can get it in our herbal stores. I've never asked before, but I normally see it. Everywhere. Anyone who has ever seen plantain? Anyone who knows what a plantain is?
Plantain, the small leafy plant.
Yeah, the small
of the plantain, the banana, the plantago.
Not.
Or
I'm talking about the antago, then the small leaf plant. So as you can see, the diagram in my slides, this one here is the plantain where my cursor is dancing. This is the plantain. You can see in this.
Not showing.
You guys can't see my in one in the left, in the right lower side, the right lower picture. It's not being seen. My cursor dancing, the pointer.
I see it.
This one is plantain, and we can always use it for salt. All that garlic is common, golden seal, echinacea, you can find it in herbal stores, eucalyptus oil, peppermint, oregano, ginkgo biloba, you can always find it in herbal stores. What I'm not sure of is horseradish, but you can always find horseradish in healthy. It's very essential when it comes to curing asthma. And then we have pineapple. We take it. By the way, pineapple has great anti-inflammatory, very powerful anti-inflammatory effects. The pineapple leaves, so you can always just boil them and take. They'll always help relieve stress. They'll always help relieve chest congestions, or you can just even take the pineapple itself. Okay, someone is joining them.
Pineapple leaves or peels?
The leaves, the peels, and the fruit, the fleshy substance. If you can get the leaves, the better. But the bark, the peels is also very essential. It's also very good. You can always make from them. You can always make some pineapple tea from the pineapple bark, so you don't have to throw it. It's a great antioxidant, a very powerful antioxidant. And antioxidants, they normally work against oxidation or oxidative stress. Normally leads to death of cells, and they can lead to several diseases like Alzheimer's, hypertension. They are normally the results, or rather, oxidation is normally a cause of various diseases. So for tonsillitis, you can always use those. You can always use garlic, onion, and ginger combination. You can always combine them. 1 to 5 of ginger, 1 to 5 cloves of garlic, a quarter medium-sized onion, and then a thumb size of ginger. You can always just beat them in a mortar and a pestle, or blend them and then add some warm water and then just drink. You can add some pinch of cayenne to it. It will help with the inflammation of the tonsils. Even the drug resistant tonsils, the over-the-counter drugs or the antibiotics that are normally given in hospital, when you use garlic, onion, ginger, and cayenne combination, it will always be helpful. It will always help you. So to thus far, is there any question? Is there any question? Okay, so let's talk about asthma. Let's talk about asthma.
Excuse me, now it's already 9, eh? So I just wanted to know how long we are going to stay on.
I'll end in the next 16 minutes. I'll end by in the next 6 minutes, not 16.
That's fine.
Okay. So we can just read through the first slide so that we can move to the next. I'll give us time to read and then I'll explain what is written there. So asthma it's normally a chronic, that's the definition. It's normally a chronic inflammatory condition of the airways. And this is what characterizes this inflammations, or the features of the inflammations, how they're normally felt. That is the airway limitation, airflow limitation. Like the air is obstructed from flowing where it's needed. When someone has an asthma attack, those are some of the things that will always show. And then the second one is airway hyperresponsiveness to a wide range of stimuli. An example, if you are allergic to certain substances like pollen grains, let's say you are allergic to certain types of animal furs, probably cats, dogs. So airway hyperresponsiveness, when your airway hyperresponds to that stimuli, when your airway is stimulated by that stimuli, when you breathe it in, then that will always be it will always obstruct airflow. And then inflammation of the bronchi, which we'll see forward. So these are some of the symptoms of asthma. We have cough, wheeze, chest tightness, shortness of breath, which often happens at night. And so to just simply define what asthma is, just note the words that are in red. A reversible chronic inflammatory airway disease, which is characterized by bronchial hyperresponsiveness of the airways to various stimuli, leading to widespread bronchoconstriction. Bronchoconstriction simply means the narrowing of the bronchus. So, of airway to various stimuli, leading to widespread bronchoconstriction, airflow limitation, and inflammation of the bronchis, causing the symptoms that we've just mentioned in the first slide. And then we can classify asthma in two different ways: extrinsic and intrinsic. Extrinsic extrinsic simply implies that that the cause can be traced. The cause can easily be traced, and more frequently, the individuals normally are atopic. To be atopic simply means they are allergic to certain substances that are in the environment, that are in the atmosphere. And then it often starts in childhood. And then for the intrinsic, it's normally very hard to tell the causative agent and the causative agent, and it's normally found in the middle age. This is asthma that can maybe be caused by extreme colds and the rest. It's normally hard to tell the causes, but basically, asthma is normally allergy. It's normally allergy. And there's a type of asthma that can be caused by fungal inflammation in the lungs. When a fungus inflames the lung. So we have types of asthma, which according to severity, they can be grouped in the five. very mild, moderately severe, and severe. So this one will just help us in trying to manage and looking for the kind of treatments to use. For very mild, we can't use the treatments for the severe type of asthma. And then, according to pathophysiology, asthma can be typed or grouped. It can be typed in these 6: allergic asthma, occupational asthma, which is still allergic bronchopulmonary aspergillosis, which is still allergic, and it affects mostly the bronchus. And then we have intrinsic. This is which is non-allergic. It's the one that we said that the cause cannot be easily ascertained. And then we have the asthma that can be induced by exercise and maybe some drugs that our body becomes resistant to. So these are some of the pathological features of asthma, which we've talked about, but I'll mention them because some I've not mentioned in the previous slide. So we have the inflammatory cell infiltration of the airways. Inflammatory cell infiltration of the airways. This is where the cells are inflamed, and in turn it affects the airways, it affects their functions. An example, let's say if the T cell in the alveoli is inflamed, then the alveolar it will be very hard for it to maintain its rigidity. And then we have increased thickness of bronchial smooth muscle. And then we have partial or full loss of respiratory epithelium. We know what the respiratory epithelium is. So the loss of it, which can be caused probably by